Hello all. The eyes are the most prominent and attractive feature of one's face. Don't you agree with me? And it is with those eyes that you make a contact with anyone you meet. So doesn't those eyes deserve the best and be eye-catching? I am Dr. Sandhya Balasubramanyan, cosmetic surgeon practicing in Bangalore and Hyderabad, talking about eyelid surgery today in our channel, The Science of Beauty. Blepharoplasty, also known as eyelid surgery, is done for both the upper and the lower eyelids to rejuvenate and restore the youthful look. So, coming to the upper lid blepharoplasty. So, it is done when someone has excess or hooded skin in the upper eyelid. So, that can make them look aged. Sometimes it can cover the lash line too and makes the eye look smaller. And sometimes it can be just that they cannot apply the eye makeup. Very rarely, it can also affect the vision in older women. Sometimes the concern is not just the excess skin, but it can be puffiness or small pockets in the upper eyelid. So, in the upper lid blepharoplasty procedure, an incision is placed along the eyelid fold and any excess skin is removed as an ellipse. The fat that is there under the skin is also removed or redistributed in its position. The eyelid muscles are tightened and the skin is closed with fine sutures. Sometimes you might have noticed that the outer brows can also be droopy. In that case, a brow lift is done along with the blepharoplasty if someone has a droopy outer brows due to aging. Unlike a Botox injection, the brow lift results are permanent. Usually the sutures are removed after 5 to 6 days after an upper lid surgery. Upper blepharoplasty is usually done under local anesthesia and you can go home after an hour after the procedure. So Asian blepharoplasty is a kind of upper eyelid surgery wherein a crease is created surgically in someone who lacks it. It is usually done in a particular ethnic group, also called as the Oriental eyes. So in our country, it is done in people from Northeast India. It is called as the double eyelid creation surgery because the crease that they have naturally is at the very low level close to the lash line and a new crease is surgically created approximately 8 to 10 millimeter above the lash line. So this is about the upper eyelid blepharoplasty. So coming to the lower eyelid blepharoplasty, it is done for the following reasons. The most common reason to undergo lower eyelid blepharoplasty is having puffy eyes with a tear trough. And other common reason is having eyelid festoons or baggy eyes throughout the lower eyelid. Sometimes it can be just a lower eyelid skin excess with the laxity of the lid, usually seen in older people. Well, lower eyelid blepharoplasty, unlike an upper eyelid, can be done in two ways. One is through a skin incision. A small incision is given below the lash line, closer to it so that it becomes inconspicuous after the surgery. The excess skin is removed and the fat pockets are realigned in its position so that the lid cheek junction becomes one smooth curve and that is the aesthetic appearance. And the eyelid is also tightened sometimes with canthopexy. So another method to do a lower eyelid blepharoplasty is through the transconjunctival method, in which case we will be putting an incision inside your eye so that no scars are seen. The eyelids are approached from inside and the orbital fat pads are aligned in positions. Sutures that are placed are usually dissolvable over time. This can be done when there is not much skin laxity, so we can do it usually in a younger patients, transconjunctival blepharoplasty. So coming to the post-procedure tips after a blepharoplasty procedure. So keep gentle cold compress on the eyes for the first 48 hours. Keep the wound clean and apply antiseptic ointment. Avoid sun exposure for the first 10 days. For this, you can either wear goggles or a hat or a scarf to protect from sunlight. Swelling and mild bruising is very common after eyelid surgery, but usually resolves in a week's time. Avoid strenuous activity for the first 3 to 4 weeks after the procedure to avoid swelling of the eyelids. Usually scars are inconspicuous and fades over time. I hope you found this video useful. You can like and subscribe to our channel, The Science of Beauty, for more such informative videos. You can also follow us on Facebook and Instagram. Thank you.